Okay, hello everybody. I just wanted to jump on here really quick to talk a little bit about survivors versus victims versus patients, you know. And of course, this is my own opinion, and of course, it's from my own experience. Um, so, a lot of you know, and some may not know, that I suffered from my 10th stroke in February of 2018. And as a result of that stroke, I actually had two. So as a result of those strokes, I was paralyzed on my left side, and I was unable to walk, and I was unable to use my left arm and my left hand. And I had to go through extensive rehab, occupational, physical, and speech therapy to regain the use of my limbs, my arms, my legs, and being able to walk. So, to kind of fast forward, I went through the rehab. I was able to regain my strength in my leg and was able to walk. And I was able to use my arm, of course. And the last thing to recover was the use of my left hand. Even though it was very difficult to use my left hand, there was still no feeling in my left hand. And so the use of the left hand came back, but the feeling did not return. So as a result, I could use my left hand, but I couldn't feel anything. There was no feeling. So of course, I was limited on the things that I could do. Like I couldn't make my bed because I couldn't feel the sheets. I couldn't fold clothes because I couldn't feel the clothes. Doctors told me not to cook because I could scar myself and burn myself and not know it and not feel it. I couldn't use sharp objects or a needle or knife because I could hurt myself and not know it until I saw blood. So, me, I am that horrible patient that doesn't like to listen to the doctor, so I refuse to just lay down and do nothing. So of course, I took my blood thinner as prescribed by the doctor, but I wanted to get back to normal. I wanted everything in my body to be back normal and be back perfect. I couldn't stand, going places and plug like to the store or out to eat to a restaurant, and had difficulty using my left hand. And this is something that we sometimes take for granted. We can feel and do what we want to do. That's how our body is supposed to function. But for me, I had to always remember I can't feel anything in this left hand. And so, for the past few days, my left hand has been on fire. It has been burning really bad. And so, at one point I was thinking, my God, did I damage my hand? Did I do something and didn't realize I had done it and, did some harm to my hand? So I'm always looking at my hand to make sure there's no bruises, no cuts, scrapes, no open wound because I can't feel it. But then I realized that my nerves were kind of acting up. So I did. I reached out to my neurologist and said, hey, I'm having this severe burning sensation in my hand. It feels like it's in fire. And he contacted me back and he said, your nerves are upset because the feeling has not been there for months, almost a year now. And now the nerves are acting up and they're trying to regain, the feeling back. So now, I'm able to feel. It's not all there. The feeling is still subdued because the nerves are still damaged from the strokes to my brain. But the feeling is actually coming back, so I can actually feel my hand better. I can use my hand better. And of course, I'm actually cooking right now. So I said that to say I don't consider myself a victim of strokes. I don't consider myself a patient either, even though I've had 10 strokes and 3 TIAs. I've always considered myself a survivor because I survived everything that come at me. I survived these strokes. I overcame everything that came towards me when it came to the strokes. The strokes have taken my speech. The strokes have taken my ability to use my hand, my arm, and even my ability to walk. And so instead of laying down saying, hey, this is the outcome, this is the conclusion, I didn't do that. I said, I'm not going to take this laying down. I'm young. I have life And I'm not going to take this laying down, so I'm going to get up and I'm going to beat this. I'm going to regain my ability to talk. I'm going to regain my ability to use my left hand and my arm. I'm going to regain my ability to walk. So of course I walk fine without a limp. I'm back in the gym. I'm running. I'm doing everything that I was doing before the 10th stroke. I'm doing everything I was doing before any of the stroke. Nothing has slowed me down. So I consider myself a survivor versus a victim versus a patient. I don't even like to be called a patient when I'm in the hospital, but because I refuse to give in to society's version of what a stroke patient look like, or what a stroke patient or a stroke victim looks like, I refuse to accept that as my life. So I took what I had, what came to me, and I made it into what I wanted to be. I wanted to be made whole. I wanted to be able to talk without stuttering. I wanted to be able to walk without a limp. I wanted to be able to make my own bed, clean my own house, fold my own clothes, cook my own food. I wanted to be able to do all of that with no restrictions, despite having all of these strokes to my brain. So I wanted to come on and encourage those who has also experienced strokes or like symptoms or attacks, that you don't have to lay there and say, hey, this is me now. I can't do this because of a stroke or a heart attack. I can't do this anymore because, this has happened to me. Refuse to accept that as your outcome and allow your mind to think those things that be not as though they were. Speak your future to pass. Speak your future into existence. And don't lie down and take what people tell you. I don't care if it is the doctor, the neurologist. Don't get me wrong. I listen to what they have to say. God has blessed me with some great neurologists and some great cardiologists, and I thank God for that. But I don't just take it lightly when God has given me something, and that's my own mind to think the things that I want to come into existence. So I just want to encourage those out there that are experiencing things like this. You don't have to be a victim. You don't have to be a patient. You can choose to be a survivor.